Welcome to this edition of Gavel In with Gowan. I'm Senator David Gowan of District 19. We have embarked into the start of the 56th legislature, first regular session, and I'd like to highlight a big issue I'll be tackling this session. The Senate has had some very eye-opening discussions over the last couple of years about our mental health system. One of the areas I believe needs improvement is the governing structure of the Arizona State Hospital, or ASH. I believe we need to create a more independent administrative and oversight body. I ran a bill last year on this, but unfortunately, it didn't make it across the finish line, so I'm trying again this session. The Arizona State Hospital is a 260-bed facility that provides long-term inpatient psychiatric care to individuals with mental illnesses, personality disorders, and emotional conditions who are under a court order to receive treatment. Currently, the hospital and those who are tasked with its administration are all under the purview of Arizona Department of Health Services, who also regulate hospitals in our state. While ASH is under the purview of DHS, the superintendent of ASH is appointed by the DHS director. There is no real independent regulatory oversight over this facility, and I think that the facility could benefit from such a structure for transparency. The bill that I am reintroducing this session also requires that the chairperson of the ASH Independent Oversight Committee be included as a non-voting governing body member. The involvement of the ASH IOC chair lends an important voice to the governing body. Public psychiatric hospitals have generally been established to take on the highest needs psychiatric patients that other hospital settings are unable to manage or treat appropriately. Our state hospital is specifically tasked with being maintained for the care and treatment of people with mental disorders and people with other personality disorders or emotional conditions who will benefit from care and treatment. In establishing an independent governing body at ASH, we are seeking to provide greater oversight over the facility and its provision of services to its patients. Proper oversight at ASH is important because of the vulnerable populations being served there. Healthcare workforce issues have also been impacting our state, so it is very important for our state to be able to recruit and retain quality staff at ASH who provide care for these vulnerable and high-needs patients. Requiring that governing body members have experience in hospital and healthcare administration will offer much-needed expertise in these areas that will greatly benefit ASH and its patients. We hope that having the expertise of healthcare professionals will make a positive impact on the treatment provided to patients as well as the culture of ASH. The governing body would be able to address important issues relating to staffing levels and safety, patient treatment, violence reduction, and hospital capacity. ASH is supposed to be a center of excellence, and I believe that the establishment of the governing body is a step in the right direction to ensuring that it is a center of excellence and that patients are getting the best care and treatment possible. I will keep you updated on this bill and many others as we move through the legislative process. Thanks for joining me, and I'll see you soon.